Welcome. Today we are going to talk about mental illness in the elderly. We shall talk about dementia, and a classic example is the Alzheimer's disease. We'll discuss Alzheimer's disease in detail, but the other form of dementia is what we call vesicular dementia that is seen in individuals with cardiovascular disease or heart disease. So what is Alzheimer's disease? It is a neurodegenerative disorder that is marked by cognitive and behavioral impairment that significantly interferes with the individual's social and occupational functioning. What are the causes? There's a continuum that exists between normal aging and Alzheimer's disease. Loss of neurons, because as a person ages, the brain does not regenerate. They are losing neurons. And once they reach that age, quite a number of neurons have been lost. There's also a decrease in neurotransmitters, a brain chemical called acetylcholine. And insoluble proteins deposits in the brain have also seen in Alzheimer's disease. But what are the risks? Who is at risk of this disease? Advanced age, especially 65 years and above. A family history of Alzheimer's, as it tends to move through families. Hypertension or high blood pressure, traumatic brain injuries, and of course the genetics. How do these elderly people present? The first presentation is memory loss. The memory loss starts in a subtle way, especially if it's Alzheimer's disease. They start by forgetting. Immediate memory basically is affected first. They start by forgetting things they've done immediately. They forget names of new people or they forget things they've done, while the remote memory is actually spared. And it's gradual, it starts slowly by slowly. They have problems recognizing other people. You find this elderly, they can no longer know the name of their child. You ask, so who is this? Like, that's my child, and forgets the name, or they can no longer remember faces. They have difficulty in organizing their thoughts and thinking. So they can no longer speak in a logical way or in an organized way. They are unable to learn new things. For example, you tell them your name now, after a minute or so, they can't remember your name. They have repetitive movements or statements. Sometimes they may have different hallucinations. They may seem to speak to people you can't see or see things no one else can see. Those are the behavior problems. They tend to have delusions, especially delusions of paranoia. They tend to think everyone is against them. People want to take their property. No one loves them anymore. They tend to be quite suspicious. And of course, as it progresses, eventually they tend to start losing bladder and bowel control. How do we investigate? Dementia or Alzheimer's disease is a clinical diagnosis. We listen, take history from the patient, take history from the caretakers, do a mini-mental exam and assess them. But other studies like brain imaging studies, CT scans, MRI, blood studies, where you look at the vitamins and the complete blood count, may be used to exclude other possible causes. How do we treat dementia or Alzheimer's disease? The first important part is psychoeducation. We want to educate the caregivers about the illness. We need to support the caregivers to prevent caregiver burnout. Imagine this was an adult who used to take care of themselves, used to do everything for themselves, but you have to start doing things for them. And as it progresses, you'll start having to clean after them. They'll start using Pampers, so on and so forth. So the people taking care of them tend to burn out. So it's important to actually encourage them and work through with them. There is no definitive treatment. You can't say it's a headache, give a painkiller and it goes. But the medications that we give is to slow down the progression. Medications that we use are anticholinesterase inhibitors. If an individual, like I explained to you, it starts gradually and worsens before someone passed on, passes on, they've reached the extreme. So what these drugs do is they slow down the progression. If the individual was supposed to take 5 years to worsen to the extreme, once they're on medication, it may add them a few more years. We also can give antipsychotics in low doses to help with these behavioral problems, like talking to people they can't see, be having aggressions, having aggressive behavior, and having paranoid behaviors. It's also important to help them do memory exercises. Sometimes, if they forget people's names, you can have the family members' pictures and write their names on the back. There, they are actually able to keep remembering them. And memory exercises tends to help keep their memory alert. In the final episode, we shall talk about stigma of mental illness. This is going to be the final episode of the Mental Health Awareness Month of May 2020. Can't wait to see you then. Thank you for watching and prioritizing your mental health.